My name is Mauricio Abrão. I am the head of the endometriosis division of the Obstetrics and Gynecology Department of São Paulo University in São Paulo, Brazil. And I am the head of the Gynecology Department of Hospital Beneficência Portuguesa de São Paulo. I'm here to tell you a few things about the disease that we are working on for many years, that is endometriosis and minimally invasive gynecology. In the last years, we are working a lot with endometriosis in different aspects of the disease. We started working with the non-invasive diagnosis of the endometriosis with many publications in this field. And it was in 2000 that we started working with imaging of endometriosis, saying that after 2007, many studies have been published by our groups focusing on the new protocols for us to map the disease. So it's very important for us to mention that nowadays to diagnose endometriosis before the surgery is crucial, even because we can strategize the best treatment for patients, and we can have very strong information about what to do, when to recommend surgery or not, and how to reduce complications and to increase the results of this treatment. In 2014, I was the president of the World Endometriosis Congress in São Paulo, and in the last years, in 2022, I was the president of the AGL, that is the American Association of Surgical Gynecology, right, in the United States. So with this experience, we are working a lot. We have many publications in this field with imaging and with the surgical and clinical treatment of the disease. So we have been working a lot with different aspects of endometriosis, from the diagnosis, from the etiopathogenesis of the disease to the clinical and surgical treatment of endometriosis. And this is why we have lots of publications in this field, and we aiming to treat the patient 360 degrees. So I think that this is crucial nowadays for us to know that an integrative treatment for endometriosis is very relevant for this purpose. We have here in São Paulo a very strong team to diagnose and to treat endometriosis, from clinical aspect of the disease to the diagnosis of the disease, to the treatment, the surgical and the clinical possibilities for us to treat patients with endometriosis, to the surgical aspects of the disease, including important things like the nutritional alternatives for us to treat endometriosis, and also the physiotherapy, that is also a very important tool to help us to improve this important problem. If you want more information about what we are doing here, or if you want to discuss with our team alternatives, even from a virtual appointment, from a presential appointment here in São Paulo, keep in touch with us. And what is possible as well is for you that wants to discuss the results of your imaging exams, mainly the MRI that you may have been done somewhere else all over the world, you can keep in touch with us for us to give a second opinion report.